Senator Sanders.
Secretary Kennedy, how are you? You know, in public life, we all make misstatements, all right? A couple of hours ago, I think you said to Senator Wyden that we now pay the lowest prices in the world for prescription drugs. That is an absurd statement. Nobody in the world believes that. Do you want to correct that statement?
It's for the drugs that are on Trump RX.
I'm not talking about drugs. You said we pay the lowest prices in the world for prescription drugs.
For those drugs, we do.
I'm sorry?
For those drugs, we do.
Senator Bernie Sanders just brought the ultimate receipt to a duel. We are talking about a brutal healthcare reality that Secretary Kennedy seemingly didn't see coming. This isn't just a political debate. This is an interrogation of an official who just loudly proclaimed that America has the cheapest drug prices, despite the fact that millions are being bankrupted by medical bills. And when Sanders pulls out the Rand Corporation report to challenge him, Kennedy's only defense is to deflect by claiming he was only talking about common drugs. Stay until the end, because the moment Sanders forces Kennedy to admit the truth and support his amendments is a masterclass in how to handle an official trying to distort reality. Don't forget to hit subscribe, because when the political elite starts sugarcoating your healthcare system, and you need to see the receipts.
Well, for certain drugs, but in general, would you agree with the Rand Corporation and every other independent survey that we continue to pay the highest prices in the world? You agree with that?
Many drugs are not covered by the agreements yet.
On average, do we pay the highest prices in the world?
As we always have, except for the most common drugs.
I'm not saying this is a new development, but you said a moment ago that we pay the lowest prices in the world.
For the most common drugs, we do. Or GLPs, or IVF drugs, or COPD drugs, or asthma drugs, for insulin.
Well, let me give you an example. For the cancer drug Opdivo, it costs $260,000 in the United States, costs $56,000 in Japan. We pay on the lowest prices, et cetera, et cetera. Senator Welch made the same point. All right, the bottom line is, look, there are thousands of drugs out there. There may be a drug here or a drug there. We pay lower prices. In general, according to the Rand Corporation, we now pay nearly 3 times as much for prescription drugs than 33 other countries in the OECD. You agree with that?
For the most common drugs, we have the lowest prices.
Sanders doesn't rely on gotcha questions. He enters actual data into the record as a primary receipt. He specifically names the Rand Corporation report. This is a black and white rule. America is paying nearly 3 times as much as 33 other countries. The receipt he's holding is the cancer drug Opdivo, $260,000 in the US compared to just $56,000 in Japan. Think about the scale of that discrepancy. Sanders' approach is how you check the uncheckable by forcing them to admit on national television that the system is exploiting the sick. Watch how Kennedy reacts when the receipts transition from drug prices to the food we eat every day.
All right. I am working on legislation which is not inconsistent with what Trump has talked about, and that is we should not be paying higher prices for prescription drugs than people in Europe or in Canada. Is that a concept that you can support?
Yes, President Trump wants this codified, and you have a lot more power than we do.
You're right. You're exactly right, and that is why I am going to be offering an amendment to the budget process right now, which would in fact codify what Trump is talking about, that the United States should not be paying higher prices than other countries around the world. Is that an amendment that you can support and get Republicans to come on board?
We will work with you, but in theory, that's exactly what we.
This is a masterclass, a high-level lesson in the art of negotiation from a seasoned lawmaker. Sanders isn't just arguing anymore. He's setting a direct trap by stating that his bill is not inconsistent with what Trump has talked about. Sanders completely locks off Kennedy's escape route. Kennedy is forced to answer yes. He even complains that the Senate has more power than the executive branch to make this happen. Instantly, Sanders seizes the opportunity. You're exactly right. An amendment forcing the administration to keep its promises is laid out right there on the negotiating table. By weaponizing the opponent's own statements, Sanders forces the opposition to publicly commit their support on national television
One.
All right, let me ask you another question. We're in the Help Committee. Casey Means, who is the Trump nominee for Surgeon General, was before us a while back. She agreed with me that TV ads, prescription drug TV ads in America should be banned. As you may know, we're one of 2 countries in the world. Do you agree with that?
Yes, I agree with it in theory. Constitutionally, you can't ban it, but we are now regulating it for the first time. And you'll see that the ads have changed on TV recently because we've sent out 1,000 disciplinary letters.
You may be right, but I think, the people who determine the constitutionality of laws are the Supreme Court.
Well, we worked a lot on it because I wanted to regulate it.
Okay, but bottom line is, am I hearing you correctly to say that you would like to see a ban on
Yes.
prescription drug TV ads?
Only the US and New Zealand are the 2 countries on this planet that allow pharmaceutical corporations to brainwash citizens through TV. Billions of dollars are spent not to research new drugs, but to psychologically manipulate you. Kennedy says he supports a ban, but immediately hides behind the word Constitution. This is the game of the elite. Blame the law to protect the cash flow. They treat the advertising of toxic drugs as the free speech of multi-billion-dollar corporations sending out 1,000 disciplinary letters. That's a slap on the wrist, not regulation. But Sanders doesn't let it go. He reminds Kennedy that the people who determine the constitutionality of laws are the Supreme Court, not an executive official trying to dodge responsibility. Once again, Sanders grabs his opponent by the collar and squeezes out the second yes of the hearing.
Okay, good. There are a lot of seniors in this country who right now cannot afford dental care. Many seniors have no teeth in their mouths, can't afford hearing aids. I am introducing an amendment to the budget process, which would expand Medicare to cover dental, hearing, and vision. Is that something you can support?
I'm happy to talk to you about it. I'm happy to work with you.
A short exchange, but it exposes the entire contrast. Sanders brings the heartbreaking reality of the working class into the hearing room, seniors with no teeth to chew, unable to afford hearing aids, and to hear their grandchildren. He proposes expanding Medicare. Kennedy's reaction: I'm happy to talk to you about it. In Washington political speak, happy to talk is the polite way of saying no. Kennedy can say yes to theoretical concepts, but when it comes to actually spending money to help seniors, he immediately retreats to the safe zone of empty promises.
Other question. Right now, we have a diabetes epidemic in this country, an obesity epidemic. Many parents who would like to buy healthy food for their kids really can't make sense of the labeling on food products. All right? Other countries in the world are quite clear in their labeling about the amount of sugar, et cetera, that's in a product. Are you guys making any progress in coming up with simple, strong labeling on food products?
Yes, we are.
When will we see something?
Well, the delay in it has been that one of the big enemies, as you point out, obesity is costing 80% of Medicaid and Medicare dollars. One of the big problems is ultra-processed food, and there has been no federal definition or any usable definition. We've now worked out a definition. There are other, and here at HHS, we're in the process of going through the interagency process. There's other agencies that are Equity, USDA, Department of Commerce, OMB, and they are reviewing our regulations. As soon as we promulgate those, we already have the labeling ready to go.
Do you have any sense when that will be?
Excuse me?
Any sense when that you'll be promulgating that?
It has to go, Senator, through the other agencies that I don't have any control, but we want it to happen quickly.
This is a perfect unmasking of the rot within the bureaucratic machine. Kennedy admits that ultra-processed food is a big enemy and acknowledges that obesity is costing 80% of healthcare dollars. He even boasts that the labeling is ready to go, but when Sanders asks when, the mask slips. interagency process, USDA, Department of Commerce. Do you know what this means? It means your children's health is being held hostage by the lobbying groups of the big food industry. Economic agencies are weighing whether protecting citizens' lives will hurt the profit margins of sugar peddling corporations. I don't have any control, a phrase that perfectly sums up the entire operational capacity of the current officials. Bernie Sanders' persistence in getting these truths onto the public record is exactly why we need hearings like this. It's not about winning an argument. It's about forcing the system to expose its own cruelty to the light. Profits are being placed above human lives, and they aren't even bothering to hide it anymore. Drop a comment below. Should Americans continue to put up with this system? And does RFK Jr.'s performance here show you who is truly calling the shots in the nation's healthcare policies? Share this video because sunlight and the truth is always the best disinfectant.